So welcome all again. Uh, so if you have any queries up to this session, you can ask me, or otherwise I will move to the next rubric.
So we have to do the next sub-rubric, right?
Yes.
Alcoholism later. Yes, sir.
Is my voice is lower? Dr. Sheetal Ospal is typing.
No,
Or is
clear.
it clear? Okay.
Yeah.
So next rubric is alcoholism, delirium tremens. Okay. So the cross reference we already discussed for this is dipsomania or delirium tremens on page number 92. So if you combine the rubric alcoholism, delirium tremens, I will ask someone to type. If he is having software, he can consider two rubrics. One is alcoholism, delirium tremens, and second is delirium tremens. And just let me know which are the common remedies and how many remedies are different in both the rubrics. Someone can do that exercise. By that time, I will talk about what we call exactly to delirium tremens. Can someone please comment? What is delirium tremens? To which patient you will say that this is delirium tremens? Okay.
We can say withdrawal symptoms, sir. Severe
Okay, but
ones,
what?
like
Yes, very good. Severe is the word. Very important.
yes, that's very important. Where there could be a lot of maybe tremors or hallucinations, or maybe kind of confused state of mind. All that could occur at same time with a higher intensity.
Very good. Very good. Very right. So, Dr. Sadia said have repertorized and put that repertorization chart in chat box. So there is only one remedy, which is tritinum, there is in rubric alcoholism delirium tremens, and it is not in the rubric delirium tremens dipsomania. Okay. So if in totality, if you are getting tritinum as a leading remedy, then you can consider the rubric on page number 92. Otherwise, you can consider the rubric on this page, what we are talking about. You can take any rubric. So there is not a lot of much of difference between both of the rubrics. Okay. So delirium tremens is a severe form of alcohol withdrawal. Madam was very rightly telling, but it will have altered mental status and autonomic hyperactivity. So what is autonomic hyperactivity? So patient will have tachycardia, he will have sweating, okay, which can progress to cardiac collapse. So this is the serious condition. Then patient will have agitation, aggression or irritability. Then he will have trembling, sweating, tachycardia, nausea and vomiting. This will happen after sudden withdrawal of alcohol. If the patient is consuming whatever the quantity of alcohol on day-to-day basis, and he suddenly stops consuming that quantity to zero, and then if he is getting such a types of symptom, then you can consider this rubric. So in the severe forms, you will have the means what routinely we see the trembling, sweating, tachycardia, nausea, vomiting, aggression, irritability. This type of presentation you will get usually in your OPD. But there are some serious conditions as like cardiac collapse, then severe confusion. I have seen one of the case where the person consumed actually the very bad quality of alcohol. He slept by around 1 at night, and next day in evening he wake up by 6 p.m. So he was in a deep stupor sleep. So actually, I have given that case opium, considering all other what we get other symptoms also. So this deep stupor like coma, मतलब घर वाले उनको उठाएंगे, they will try to wake up, but the patient will not wake up. So deep sleep that will last for a day or longer. So this is the presentation of delirium tremens, what you can call it as a delirium tremens. So the tremor remedies we can usually see over here. So first remedy will come in this section is agaricus. So you will open page number 18 from Katak Matra Medica. Are we going right, or I need to go slow, or I need to go fast, or something changes you want? So if you open agaricus on page number 18, so Katak sir writes acts of cerebrospinal axis, which leads to vertigo, delirium, then trembling.
सर पेज नंबर 80 नहीं है
1818.
Old
हाँ.
book, it is 15.
Oh. So Agaricus first line acts on cerebrospinal axis, then irregular, angular, or certain exaggerated motions, then trembling, twitching, jerking, which is written in capital, so it is very much important for this. Then if you go to the aggravation worse, then there you can see debauchery. So we have already discussed the debauchery. I will elaborate the word debauchery more. So the person will have multiple partner, whether male or female. He will what we say. He will cheat the person to whom he or she married. He will have the addiction of alcohol along with drugs, tobacco, smoking, etc. So this type of patients you can have debauchery. So the debauchery along with delirium tremens, you can think of agaricus when they are coming to you with the complaints of vertigo, delirium, trembling, twitching, and jerking. Then what will be the another mental symptom? Then in mental symptom, loquacity will be there, which is written in Roman. Then they will throw the things. It is written under mind section of agaricus. Then I will compare this with the second remedy under this rubric, that is hyoscyamus, which is on page number 354. So on page number 54, did you open? Those who
Yes,
don't
sir.
have these both books, I think they may be they may got bored. Okay, so hyoscyamus. So what Dr. Pathak said, right? It disturbs the mind, brain, and nervous system profoundly. So these three systems are disturbed very profoundly. Then next here writes it causes a perfect picture of mania of a quarrelsome and lascivious nature. So patient will argue, or a patient will fight with the family members or the wherever he is, and uh, the lascivicious nature. He can all of you know the lasciviousness of hyoscyamus. I don't need to take your time much about that. Then if you ask the history, I always do this thing. I have learned this thing actually from Sarkar sir. I always in my friend circle, I always say that Sarkar sir is a mathematician of homeopathy. So why do I say mathematician to him? Because if you read his many of the books, just to see, just to think, then he writes under the remedy plus. He will write uh, depression plus alcoholism plus tremors. Then such and such remedy you can think of, or otherwise he will write. So you can think to prescribe remedy. In all you can have a totality. So hyoscyamus आप किस patient में सोचोगे? So the patient who has disappointment in love, not necessary that this should be the love between male and female, but this can be love from parents when the child was at the age of adolescent, and he has started drinking alcohol from that age. Then along with that, he is having what we can say is taking alcohol daily, and he has disappointment in love. Then he started taking alcohol. Then the he stopped alcohol and then delirium tremens, and then these symptoms. If you get the totality from past history up to up till now, then sure shot your remedy will work. So this is plussing of the all in all totality by Dr. Sarkar sir, what I have learned. Then bewildering aberrations are there, that is loss of sense and location, what we talk in OPM also. He does foolish things, behaves like a mad. You can read the, someone can please read the Alzheimer's mind.
Many bewildering aberrations, mania, erotic females, expose genitals, sing amorous songs, does foolish things, behaves like one mad, laughs, sings, talks, babbles, quarrels, fumbles the genitals, jealous, suspicious,
I will just stop you
fears
for a
being
while, ma'am.
alone.
I will just stop you for a while. I have given one patient. I think he's around the boy is around 3 years or something like that. Around 3 years, he was always coming to my clinic and he was holding his genitals like this. He was not having any skin disease over there. I have seen him. He was also restless and very hyperactive. So I have tried some of the remedies like tarantula, then zinc, but everything was failed. Lachesis was also given to him. But when I come across this now, fumbles the genital. So what is this fumbling? Can anyone even explain? What do you mean by fumble? What will be the action to fumble genitals?
Tolna.
Tatolna, very good. So he will hold the genitals and he will just like this. He will do that. Okay.
Yeah, it's
So
basically like holding the
hold it just
hold
like
on
this.
something with
No,
your
no,
hands. Yeah.
holding is like this only. He's holding genitals. When fumbling, he will have like this.
Keep
In
feeling
nerve,
it off and on, off and on, off and on, kind of. It's that
So
kind.
only on this observation, after failing many remedies, I have prescribed Hyoscyamus 1 and 3 doses, and if I have video of that boy, I have before and after videos also of that baby. If possible, I can share with you. Please continue, ma'am. Sorry.
Then we have jealous, suspicious, fear of being alone, being pursued, fear of water, being poisoned, being bitten, laughs at everything foolishly, restless, jumps out of the bed, wants to escape,
So you will get this
utters each
presentation
word.
of restlessness, jumps out of bed, wants to escape in delirium tremens of Hyoscyamus. Okay, next. Madam, please continue.
Speaks each word
Rage
louder.
with desire to strike, bite, fight, insult, scold, and kill.
You will get
Plaintive
this
cries,
presentation also. Okay,
especially
continue.
plaintive cries, especially on the slightest touch, even in stupor. Unconsciousness can barely be aroused. Muttering delirium. Thinks one is not at home. Speechless from fright. Confusion. First cannot think, then can scarcely be aroused. Talks with imaginary persons to dead ones. Imagine things are animals. Fear of being bitten by beasts. Plays with fingers. Silly, does comical acts. Looks at hands because they seem too large. Syphilophobia.
Okay, so what are the important points in delirium tremens under mind? So already I have discussed some points, and then in definition, I have told you that the patient will drink up to the limit that he will sleep for a day or more than that. So if you read the line, unconsciousness can barely be aroused. I was telling you that the family members will try to wake up him from the sleep, but he will not wake up. So this is the clear-cut remedy in such a cases to prescribe Hyoscyamus. So you won't get Hyoscyamus every time he is opening his genitals or he's lascivious and he's talking and he's behaving foolishly. But you can get Hyoscyamus in such a conditions also. who is left like in deep comatose condition, and you may think of opium in such a cases, and you may go wrong. Okay. So next remedy to compare is stramonium. So it is on page number 667. Can somebody let me know the Marathi name of Marathi or Hindi name, the most common name we use for stramonium?
Dhatura.
Very good. So those who have done CCMP course in Maharashtra should must know the Dhatura poisoning. The short note is asked in MHS exams. So all those symptoms of stramonium or Dhatura are there. So this stramonium acts on brain. So Dr. Patak sir writes it acts on brain. Then he writes hallucinations. So what is hallucinations? We homeopaths know the delusions very well. When I was very new, 5-6 years back towards the homeopathy, then I have taken almost almost I have not understood the word anxiety and delusion for almost 6 to 7 months. I was lost.
False
Between,
perception.
huh?
False perception.
Very good, sir. This is the one word which describes hallucinations. What's your name, sir?
Rohit Kumar.
Very good. So false perception, but what type of false perception patient will get?
So
So
could it be
sensory
related to
perceptions.
visual? Could it be visual?
Okay, okay, right. So visuals में
It can be
objects
visual,
रहेंगे
it can be
जो हाँ बोलिए मैडम.
visual, auditory, everything. So sensory.
Very good,
Sensory
very good, very
perceptions.
good. This is one more right word. So object perception of so false perception of objects. छोटा रहेगा, बड़ा दिखेगा, बड़ा है, छोटा दिखेगा. Or otherwise, if there is absence of object, still he can see that object over there. मीन्स कोई कोने में खड़ा है, उसको लगेगा दैट इज हालुसिनेशन. डिल्यूजन में क्या होता है, पेशेंट एक्सपीरियंस करता है. ओके. So false perception of objects or events involving your senses. So that is they seems real, but they are not real. Okay. So can you give me any example? I have given you one example, 2 examples. So can you give the example of hallucinations? Commonly what we get?
A
Or you
rope
have
feeling like a snake. Rope
very
which
good,
could feel like a
Catheter
snake.
very
dream.
good, very good, very
Yeah.
good.
Hallucination is mirage. Mirage you see in desert.
I didn't get it now.
Cases.
Mirage,
In
mirage.
cases of,
In a desert you see
Okay,
like it
yes,
is
yes,
water,
yes.
but when you
Yes,
reach
yes.
there,
But
it is not.
Very good.
It is not water. It is yes.
Very good, very good.
That is
But
hallucination.
okay, okay.
in cases of schizophrenia, auditory hallucination,
Very good,
पेशेंट
sir.
को लगता है कि उसके कानों में कुछ आवाजें आती है.
Okay, so these are fixed notions, terrifying. Under what under stramonium, Dr. Patak sir writes, he has fixed notions, terrifying. That is why this is the remedy of terrors. Stramonium is the remedy of terrors. If you don't find terrors in your delirium tremens case, then there is no indication to prescribe stramonium. Almost in maximum in maximum cases. Sorry. So it is the change in mental abilities leading to confused thinking of patient and lack of awareness of surrounding. That is the disorientation of stramonium. So, madam, can you please read stramonium mind section?
Yes, sir.
Okay.
Stramonium
Mind.
awakes terrified, knows no one, screams
This
with
is mostly
fright,
applicable in pediatric cases. You must be
clings
moving
to
on.
those near him.
Very good.
Dread of darkness and as a horror of glistening objects, praying, singing devoutly, beseeching, entreating, ceaseless talking, fearful hallucinations which terrify the patient, sees ghosts, vividly brilliant or hideous phantoms, animals jumping sideways out of ground or running to him. wildly excited as in night terror, does all sort of crazy things, active variable delirium, delirium tremens, raving mania with cold sweat, religious insanity, the talk by others is intolerable, self-accusation, loss of reason or of speech, strange absurd ideas, himself tall, double, lying crosswise, one half of the body cut off, etc.
Okay, just stop, ma'am.
Desires.
Just okay. चलो, यहाँ तक आपको हो गया delirium tremens में stramonium का presentation what will be. I will ask you. Patak sir had written raving mania. What do you mean by raving mania? How patient will present? How you will know that this patient is in raving mania? Mania we can understand, which are uncontrolled outbursts.
raving I think with rage
With-
बोलते हैं ना उसको
With rage क्या करेगा sir?
sir,
Patient what?
Talking wildly.
Very good. Who has
रेविंग का
answered?
मतलब इनकोहेरेंट टॉक है,
Dr. Varsha, sir.
कुछ भी फालतू बात या पागल बात कर रहे हैं.
Okay, whatever he will talk, but
Raging-
he will talk wildly.
Wildly.
That is
एंगर से
Wild,
ऊपर
yeah.
जो होता है वो रेजिंग होता है.
Very crazy, like informal.
If you want to prescribe stramonium in such a cases, then always keep in mind that stramonium is the remedy of terrors so though it is the remedy of terrors for the patient, but it is a remedy of terror for physician also. What I have seen in few of cases if you take the case history of stramonium patient you will shock after taking the history from the relatives or usually relatives will tell you that you won't easily dare to start treatment to such a patients in especially of maniac. So you will get terrified to treat such a cases. Okay.
Sir, can I get an example of this tremonium? Can we
Please.
correlate this with the movie of this that Vidya Balan's movie was there, na? Bulbulaiya. In that character, the Vidya Balan had. Can we relate that character with this tremonium character?
Actually, sorry, ma'am. I didn't watch that movie, so I cannot comment on that. If someone has, then please comment.
I think she was more of possessed kind of a feeling what she had in Bhulbulaiya more than this, yeah.
But that is also
That
a
is-
type of schizophrenic condition, right? That was
Schizophrenic, you
actually
can see-
related to schizophrenia.
See. What we see in horror or terror movies, we also get terrified,
Yes.
We also get terrified while watching those videos, especially
Yes,
if you are
yes.
watching those videos
Yes.
when you are alone or you are in dark, then
Feared,
definitely
scared.
okay. So always consider stramonium maniac patients whenever you are taking the case. After taking the case, you will also get those vibes that whether to treat this patient or not. If some senior practitioner from Nasik are attending this session, then I will just share an experience. I was student of BHMS. This is a long back story. I think more than 25 years back. I think the doctor's name was Dr. Bhavsar. He was practicing pure homeopathy in Nasik. He was treating a case of psychiatry, and I don't know what medicine he had given, but eventually after some time, when Dr. Bhavsar was jogging for his morning walk, then that patient had a knife and he just killed that doctor on the spot. So
What?
Oh
he
my
killed that
God.
doctor. Yes.
Sorry.
Oh
Yes.
my God.
It has been there in newspapers at that time. Some senior doctors from Nasik can confirm this thing if they are knowing this thing. So always remember.
So he went wild. He went wild. The exact
Yes,
word, the
wild desire to
wildness.
killing mania. So always remember to handle such a case very cautiously.
Yeah.
Okay.
Sir, I would like to share one case similar.
Okay.
Few months back, my neighborhood was there, and she called me. She got an attack, like maniac attack, and क्या हुआ कि वो जब बात कर रही थी फोन पे एंड इट वाज लाइक कि somebody else is talking, वो दो वॉइस मिक्स होके उसकी आवाज थ्रो हो रही थी फोन पे, and it was similar like somebody has possessed her. And at that moment of time I didn't had stramonium, but we have prescribed belladonna, then we have referred to psychiatrist. But whatever you are saying ना, the patient को जो feeling होती है ना वो terror वाली, वो हमको भी feel होती है. I was literally terrified with hearing that voice. I was in contact with that patient and I know she is not like that, and at that moment of time it actually like a vibe of terror run on my body ki, should I go with this case or not?
You
So
can think of
stramonium patient.
you can think on your own, because I have just heard that one that episode with one bad incident with one doctor. But I just wanted to share with you all that in such a cases, choose wisely. These are not the only
Yes,
cases you are going to get to be treated. You have many of the cases you need to be treated.
yes,
My question, my query to Dr. Ronin sir over here about this case, what that lady doctor was telling that she was going to prescribe stramonium, but she was not having stramonium, but she had given belladonna to that patient, but still belladonna worked for a while. I don't have the much knowledge of that remedies of group of families, what we see in homeopathy. But I think belladonna contains hyoscyanin as an alkaloid, and stramonium also contains some alkaloid, and they may be having similarities. So that might be the reason it has acted. Is it right or something else?
Yes, it's definitely it's correct. A lot of solanum nigrum, all kind of solanum help when it seems like stramonium cases. Because of the alkaloids, it's very similar. And works also, yes.
Okay, thank you, sir. So you might have got your answer, ma'am, that belladonna was also. So we need to think on those lines also while prescribing. This is the practice. So
yes, sir.
we'll go to the next rubric. These are the common remedies under delirium tremens, which I wanted you to compare and to have handy the knowledge to have differentiation. The next rubric will go to the anemia. Commonly used rubric is anemia. Page number. Anemia. So many of the patients come to you with directly with the report that doctor, this is hemoglobin 3.4.3, 5, 6, 7, 8, 9, 10. So which patients you will label as anemic patients in India for males and females?
So less than 10 in females and 12 in males.
Okay, someone please. Is it right answer?
Anything, yes, sir. Anything below 11 is considered to be anemic loss. Depends on what state the person is, pregnant state, normal state, whatever. So anything below that, anemic.
Okay, so we have different range for males and
Markings
females in
maybe.
India. We are different range for range to label the case as anemia
Marks.
in India for males and females. So this is your homework. I will not tell you what is the exact range. You will study and post that exact range in the group. Okay. So I will directly move to the next sub rubric of anemia. Grief from anemia, grief from. So first remedy is natrum mur. So कितना सही है ना कि Dr. Phatak sir has written the grand remedy like natrum mur, which is having a lot of griefs, the silent grief, the bitter grief, the bitter disappointment, the since long, and he has written that remedy to consider under grief from anemia. So what is grief?
It's sadness, sir. Sadness.
The sadness, dukh, man ka dukh.
Dukh. Or what more?
What is Duke? What
That is
Duke?
sadness. Chalo, please come up fast. What is grief?
It is intense sadness, which could happen due to a loss of a beloved or whatever, a beloved person, animal, whatever.
Disappointment week.
Yes.
Disappointment,
Yes.
displeasure week. Okay. So those who have answered grief as a sadness or grief. So you have different rubrics in pattern. One is grief. You can just go to page number 172 and you just see the rubric grief, sorrow, and sadness is the rubric on page number 334. Okay, both are different rubrics in pattern. So sadness is
Yes.
different and grief is different. So you don't need to consider. Who have talked that grief is deepen sadness. Okay. So what? What?
Grief, boisterous क्या है sir?
मैं बाद में बताता हूँ मैडम, पहले रेमेडी डिफरेंशिएट कर
जी
लूँ.
सर. जी सर.
हाँ हाँ, मुझे एक बात बोले ना, अभी हम लोग है ना नेक्स्ट सेशन करते हैं. विल डू इट दिस इन नेक्स्ट सेशन बिकॉज ओनली 2 minutes ऑफ दिस मीटिंग आर रिमेनिंग and
Yes,
there are
sir.
many remedies to differentiate it. If someone have any queries, they can ask. Then we can wind up today's session. And thank
sir,
you for
मुझे
all.
दो
Thank
queries
you.
है.
Thank you for all. Thank you all for
Thank you very
attending.
much, Dr.
And,
Bogle.
special
Thank
thanks to
you.
Dr. Ronen Levy sir for blessing
you.
me.
Thank you very much.
I'm really honored to have you over here. So thank you,
I
sir.
enjoyed very much. I enjoyed very much. Thank you. Thank you
Gratitude,
all.
sir. Gratitude.
Thank you,
Sir,
sir.
I have-
Wonderful session.
Thank you.
Dr. Madan, thank
Oh,
you
yes.
Thank you.
for being here. Thank you, Madan.
Thank you. Good evening to you. Good evening.
Good evening.
It's really nice to see you.
Yes, we are seeing again. We meet again.
All right, certainly. Thank you. Dr. Jyoti?
Sir, how are you?
Oh, yes, yes, nice. Thank you very much.
Yes.
Just if you find my number, just say hello because I need to talk to you sometimes.
Okay, sure. I
Dr.
will.
Jyoti, thank you
Yes,
very
I
much.
have your number.
Thank you.
Yes. Yeah. Thank you. Bye-bye.
Namaskar.
Okay, so I think no one have any queries, so we'll wind up
Sir, I
today's
have
session.
question. I'll put on the
Okay.
group, sir. Is it
So
okay?
we will put it on group now, sir. It's getting a little late.
Okay, chalo. Good night all, and thanks for your active participation.
Thank
I'm
you.
really
Bye-bye.
grateful to all of you. Chalo, bye. Good night.
Dr. Bogle, namaskar.
Namaskar, sir. Chalo.